Good evening, everybody. We are going to wait a couple seconds. We're letting people in for tonight's webinar. My name is Allison Foss, and I am the Executive Director of the Myasthenia Gravis Association. I'm joined tonight by our team members, Catherine Clemens, Hallie Walker, and McKenna Fulton. We are so glad that you're here. If you're new to the Myasthenia Gravis Association and you need a patient packet or information about our support groups or clinics, please reach out to us at info@mgakc.org. Tonight's presentation, we are joined by Julie Rowin, and I'm going to give her an introduction here in a second, but a few little housekeeping items. We will use the Q&A for tonight's session. So if you have any questions, please put them in the Q&A. Just a gentle reminder that questions regarding your own personal situation are best discussed with your physician. So save those questions for your doctor, but other questions, please put in the Q&A. Following tonight's session, you're going to get a survey, and we would love your feedback on the session. The survey will also include the next webinars and upcoming virtual presentations that we're hosting. So again, tonight we are thrilled to have Dr. Julie Rowin, who is a board-certified neurologist and neuromuscular specialist with us. She received her medical credentials in the Chicago area from Northwestern University Medical School. She did her training in neurology, neuromuscular medicine, and electromyography at Rush University, where she served as assistant professor in neurology. She also served as associate professor in neurology at the University of Illinois. She has extensive history in muscular dystrophy, myasthenia gravis, and ALS. She has provided medical and scientific input as a member of several medical advisory boards and has been a reviewer of several neuroscience journals. After becoming interested in functional medicine and acupuncture, she combined neuromuscular medicine and integrative medicine into a private practice. Dr. Rowin currently resides in Sedona, Arizona, where she is an independent consultant participating with industry, patients, and patient advocacy groups to provide insights into holistic approaches to disease management, focusing on neuromuscular and autoimmune neurology. Julie, we'll let you take it away.
Thank you so much, Allison. It's great to be here. I really appreciate this opportunity to talk about what I'm passionate about, and that is lifestyle medicine and all the ways you can improve your health, improve your life by taking a holistic approach with your myasthenia. Just if there's anybody that's new here today, I have an introductory slide to understand what is myasthenia gravis. It's an autoimmune disorder that causes muscle weakness, particularly in the eyes, face, throat, and limbs. The disorder occurs when antibodies disrupt communication between nerves and muscles, leading to weakness and fatigue. The diagnosis involves clinical exams, blood antibody tests, and images like CT or MRI to check for thymoma. I got interested in something that I call root cause autoimmunity when I developed autoimmune condition, different from MG, but mine is treated by a rheumatologist. And when I started really broadening my scope and learning about my condition, I realized the commonality between all autoimmune disease. And I think a lot of times in neurology, maybe we missed out because most autoimmune disease are seen by other specialists. And a lot of the research in autoimmune conditions is done in other specialties like rheumatology. So today I'm going to pull from different literature outside myasthenia and my own experience to relate to what I think is important to know in myasthenia because of all the commonalities between autoimmune disease. And when I started getting sick, I just had new kinds of questions pop up, such as, I don't want to take medicine. What can I do to lower any kind of medication I have to take? What kind of lifestyle factors can help me? Is there anything I can do to help in remission? And on and on. I didn't want to limit myself to medication only. So I found something called functional medicine, which really has revolutionized the way I think about medical care. And that's what is at the root cause of disease. And we think of three things when we think of autoimmune disease, including myasthenia, and that's a genetic predisposition. Impaired barrier function. I'm going to talk a lot today about diet and gut health because we're learning more and more about the association between gut, the microbiome, and autoimmune disease. And I'm going to talk about environmental triggers such as food, toxins, infections, stress, and sedentary lifestyle. That was a lot for an introduction, but I just like to give my story a little bit so you understand why I started getting interested in this approach and how I've seen it really help people. And I went on to study a lot of different kinds of medicine and holistic medicine, including traditional Indian medicine, some traditional Chinese medicine, acupuncture, and functional medicine, which has a lot to do with lifestyle. And I really ended up kind of honing into the most important things I think to talk about are what we're doing every single day and how that helps us manage any kind of condition we have. So lifestyle medicine is exactly that. It's what are you doing every day with your nutrition, your mobility, your stress management, sleep, social support, and the avoidance of risky substances such as cigarettes and alcohol. So I'm going to talk mostly about diet, exercise, and stress management, focusing a lot on mood and fatigue because I find even though people's patients' myasthenia is fairly stable and well controlled with medication, some of the most common, like lingering effects, are often around mood and fatigue and prednisone side effects. So this slide I developed to describe how lifestyle factors can really help improve mood and fatigue. And when I talk about fatigue, I'm talking about generalized fatigue. The neuromuscular weakness, which is fatigable, that happens in myasthenia gravis, I would say, is better treated with medical management. But this diffuse kind of fatigue, run over by a bus type feeling, that's common to a lot of autoimmune diseases, that's what I'm talking about here. And thing I like to point out is that when we look at a lot of times in the literature, they're trying to isolate one thing and say, how does sleep affect mood and fatigue, or how does physical exercise, how does mindfulness, for example, they're isolating one factor. But the point I want to make is really the more you can do, the more it's going to help you. And everything interacts with everything else in lifestyle. Like you can't separate one from the other. For example, sleep quality is very dependent on nutrition. It's dependent on exercise, and it's dependent on your stress levels. The same thing with physical exercise. If you want to get stronger, you can't really get stronger if your nutrition is poor, if you're not sleeping, or if you have a lot of stress. It's actually, the stress is going to make you not be as effective with building muscle and would lead you more towards storage of fat. So there's this complex interplay, but the thing I want to point out is the more you do, the better you feel. The less you do, the worse you feel. And I'm sure you probably noticed it in your own life. So there's a lot of different diets out there. I'm focusing just on the Mediterranean diet because there's so much literature on it. I mean, thousands of articles have been written on the Mediterranean diet and how anti-inflammatory it is, how that it can be effective for mood and for fatigue. And that's when I point to literature, I'm pointing to that diet because of the fact there's so many, is a plethora of research on it. However, it's not the only way to eat, of course. And you can eat healthy without specifically this diet, but that's why I'm pointing to it. We're really going to focus on fruit, vegetables, whole grain, olive oil, fish, and nuts and legumes, poultry, low-fat dairy and eggs, and very little red meat or sweets. Because there's a very strong correlation between eating a whole food plant-based diet and having an anti-inflammatory lifestyle helping chronic inflammation. And this is true with cognitive function, it's true with heart disease, it's also true with autoimmune disease. So I know that sometimes there's mixed communication about if diet can benefit MG, but I hope with this slide I can just put that kind of question to rest, because even if there's not a specific clinical trial testing diet in myasthenia gravis, like I said, there's this plethora of research that shows it's a diet such as a Mediterranean diet is helpful with all the things that's associated with myasthenia gravis, like infection prevention. We definitely don't want an infection. Sleep quality, improves mood and stress, improves fatigue, and improves your bone density. So all these things are things that we want. So that's why I'm a big proponent of an anti-inflammatory diet in myasthenia gravis. And I just want to make a couple points about what the diet for most people is missing. There's something we call the standard American diet, which is unfortunately the way most Americans eat, very pro-inflammatory, and has been shown to impair immune function. And this is really a diet that's high processed food, fast food, oils, hydrogenated oils, sweets, a lot of meat, and very little fruit and vegetables. Leads to a lot of sickness in our country. You can think about it as food is information for your cells. So processed food, like food at the bottom, can create an environment that promotes inflammation and immune dysregulation in your body. And I want to talk a little bit about, I'm going to talk over and over again about fruits and vegetables and fiber, because that's where I think people fall short. And this is just a slide showing how the different people fall short on getting fruits and vegetables, basically. It's what I'm saying with this slide, but there are individual benefits to eating all the different colors, because all the different colors of fruits and vegetables actually have different antioxidants, different phytonutrients, and nutrients that are in plants that help your immune system. So I like to say eat the rainbow. And I have another slide on that too. One more thing I want to mention is there's a widespread vitamin D deficiency. Vitamin D is super important for immune function, so I would have that tested if you haven't. People are also commonly low in B12. There can be low vitamin C and zinc. All these things can be helped with diet, but sometimes, like vitamin D and B12, it needs to be supplemented as well. And sugar, anybody who's ever been a patient of mine knows how I feel about sugar. Is often disguised in processed foods. It goes by, I'm sure there's more than 56 names, but producers of food like to have sugar in products because it sells. We get really used to the taste of sugar, and so a lot of times on the label, there'll be sneaky names that make it sound healthy. But it's not. It's still sugar. and evidence links sugar to all these kinds of side effects: obesity, hypertension, high triglycerides, insulin resistance, diabetes, bone loss. It's the same list as prednisone side effects. So definitely, if you're on prednisone, this is really something to take serious and avoid. And plus, it's very addicting and hard to wean off sugar. But I've had a lot of experience with people who have significantly reduced sugar in their diet and have significant improvements in things like mood and pain, like right away. It's a big driver of inflammation. I'm not saying it's going to cure your myasthenia, but I am saying that it is going to make you feel better in a lot of different ways, and also prevent a lot of problems down the road. So just so you know that I say eat the rainbow, this is my husband making a rainbow stir fry. We do it. We try to get all the colors of the rainbow in our diet every day just by having recipes like stir fry or smoothie or something that really can make it more convenient, because eating vegetables and fruit, here it's 7+ daily portions a day, is linked to 42% lower risk of death from all causes. It's like a huge, amazing thing we have. It's called food and it's medicine. And I think of everything I put in my body as medicine or a toxin, and I try to avoid the toxins. So some things here we can do for vitamin D is to get outside and get some sunshine. So even just a little bit in the morning, 15 to 20 minutes with 40% of your skin exposed, is going to help improve your vitamin D level. You can also take things like cod liver oil or pasture-raised eggs or wild-caught fatty fish or mushrooms also have D. So a lot of people I know still need to supplement. However, regardless, for some reason, like I said, vitamin D levels tend to be really low when we check them. Other thing I find is very helpful and anti-inflammatory, not only for autoimmune conditions, but for brain health and heart health, is making sure to eat essential fatty acids. These are fatty acids you cannot make in the body, so you have to eat them, and that's why people are low, because nobody wants to eat their fish. However, fatty fish is a great source, but you can also eat flax seeds, chia seeds, or walnuts, olive oil or avocado oil. I would say if you don't like eating fish, you might want to consider supplementing with fish oil or cod liver oil. And I like to remind people about having fresh spices and green tea around in your cabinet, because they're really rich in antioxidants and can help reduce inflammation. Turmeric, ginger, rosemary, cinnamon, they can all support overall immune health. And it's great to sort of have these options and to be able to think about herbs and food in new ways, as ways that can help you, and things you can just put in recipes and supplement in your diet. I am a big fan of turmeric root and curcumin. I like to tell people about it because it's such a potent anti-inflammatory, can really help with any kind of pain, muscle aches. The only thing to be cautious of is if you are on a blood thinner, it can interact, because it also, in a healthy way, makes your platelets less sticky. Also, mushrooms, I don't see people eating a lot of mushrooms, but they have great health benefits for the immune system, particularly like shiitake mushrooms or reishi mushrooms, chaga mushrooms. And they come even in powdered forms. A lot of people like them in their coffee. They have kind of a coffee taste, or in your tea. But they can also have high vitamin D and protective against viruses. I'm going to talk a little bit about the microbiome. Don't know if you've heard about the microbiome. This is something we really realized the importance of in the last, I don't know, 20 years maybe. When I was in medical school, we never talked about the microbiome. It's like now it's a new organ. It's what it is. It's the trillions of microbial cells that live in your body, mostly in the gut, and we can't live without them. They're very beneficial for digestive support, immune system protection, as well as brain health. This microbiome, the majority of these cells live in the gut, and that's why gut health is so important when you have autoimmune disease. So our gut houses 65 to 70% of our immune cells as well as the microbiome, and they communicate with each other. It's a fascinating subject if you're interested in it. We have more healthy bacterial cells in our body than we have of our own human body cells. And they're key to our immune regulation. So we want to eat foods as well as live a lifestyle to promote healthy gut bacteria. And you'll see like how I'm repeating myself over and over, and how all of these lifestyle factors really interact with each other. So how we have a healthy gut microbiome is through exercise and diet and what we have in our environment, and avoiding antibiotics when we can, because if you can avoid them, it's better, because not only will you kill bad bacteria, but you'll kill the good ones too. And then everything needs to repopulate. Obviously, antibiotics are life-saving in certain situations, but also they can be overused. So I'm just putting that precaution out there. So how do we boost our microbiome with food? Fiber, again, adding fermented foods, and again, avoiding gut disruptors like antibiotics when possible. Probiotic foods, like most people have heard of yogurt, and we know there's beneficial bacteria in it, but there's all kinds of different probiotic foods, sauerkraut, tempeh, pickles, kombucha, miso, kimchi, kefir. I would suggest, trying them out and adding some into your diet slowly and see how you feel. Certainly needs to be introduced slowly, because can cause gastric upset if you have too much too soon. But again, fiber is super important for maintaining a healthy gut microbiome. These are just some examples of fiber-rich foods. I'm going to say it a bunch of times. It all has to do with eating fruits, vegetables, and fibers. It's because the bacteria actually eat the fiber. It's their food. And that's why fiber is so important, because these microorganisms really act as our intermediary between our environment. So everything that we do in our lifestyle acts on the microbiome, and then the microbiome communicates with our cells, like our immune cells. So to sum that up, pay close attention to omega-3s. That would be fatty fish, walnuts, chia seeds, those kinds of foods. Important, pay attention to your vitamin D. Get that checked if you haven't. Fruits, vegetables, and fiber. Eat the rainbow. Try every day if you can to get all the colors in. And I think it will really help you. I'm going to talk a bit about exercise in myasthenia gravis. This is, you hear, or I used to hear a lot, pace yourself. And of course, it's important. But I think for a long time in neuromuscular, we gave this message where if you exercise, it's going to make your disease worse, which isn't true at all. Certainly, if you're not stable and you're having swallowing problems or breathing problems, it's not the time to start an exercise program. But once we're stable, the evidence is clear that it's going to help improve strength and function. I'll give a few caveats later. Of course, you have to start where you're at. I mean, there's no hurry. It's just that being immobile is such a cause of so many problems that it's just not an option. It's hard for everyone to exercise. It's like 100 times more to exercise when you have myasthenia gravis, I understand. But we just have to start where we are and keep mobile. There's been about 456 patients of the time I wrote this slide that participated in clinical trials of supervised exercise in myasthenia, and most of these trials showed improved strength and improved function overall. And some of the trials also said there was improved fatigue. And exercise is really our fountain of youth. So it's not only that it makes you stronger and improves function, it reduces inflammation, and we're back to the inflammation again. It improves your microbiome, back to that again. It enhances energy, it improves your sleep and mood, all circling around. So when your disease is stable, stay active. And this can mean whatever this means to you, with things that you enjoy, gardening, yoga, walking, socializing. I just always just say start low and go slow. Any of these lifestyle changes are for the long term, for the rest of our life. So there's no hurry. It's not like you have to go to the gym tomorrow, you know? It's like maybe you want to start with physical therapy, or maybe you want to start walking to the mailbox and back. It just depends where you're at. Not a contest. Listen to your body, prioritize and rest, and progress slowly. One thing I found really motivating and is community when it comes to exercise. And there's a Myasthenia Gravis exercise Facebook page that I haven't been on in a while, but whenever I go on, it's just super amazing to see people coming together and supporting each other with whatever physical activity they can do with their myasthenia. Talk briefly about toxins in autoimmune disease. So unfortunately, there's more and more toxins in our environment, in our food, in our water, and toxins can disrupt immune system regulation. So I'm just going to be giving some tips as to how to minimize toxins and maybe things that you don't necessarily even think about. But I suggest choosing natural cleaning products and personal care products. If you wouldn't eat it, don't rub it on your skin. That's what I say. You can use natural moisturizing agents for coconut oil, olive oil on your skin, things like that. You can wash your produce thoroughly. I'll talk about choosing organic fruits and vegetables over conventional. It's great to think about your indoor air quality, avoiding cigarette smoke inside, getting a HEPA air filtration system for your bedroom or for your main rooms, and keeping your house ventilated. And avoid heating or microwaving in plastics or Teflon. And of course, alcohol is also a toxin, because we are what we eat, drink, breathe, and touch, and can't eliminate. So we want to be able to support toxin elimination, and how we do that I'm going to keep repeating myself, but the new thing on this slide is drinking plenty of water. Half your body weight in ounces per day. And if you can get a reverse osmosis filter, it's great for removing the microplastics that are in the water, heavy metals, and other toxins. Clean water is important, clean air. Again, eating vegetables and fiber help support toxin elimination through the bowels. Super important to have regular bowel movements. Sometimes your doctor doesn't talk to you about this, but 1 to 3 bowel movements a day is really crucial to support your digestion, and your toxin elimination. It's the same with physical activity. We're talking about that again, how regular exercise helps the body process and eliminate waste effectively, particularly through sweat. And I like to consider overnight fasting benefits, meaning stop eating after dinner and don't eat until breakfast, maybe 12 to 14 hours off of food. And what this does is it helps inflammation and boosts cellular repair. Because during that time you're not eating, your body puts energy towards repairing cells rather than digestion. This is really good, again, for your gut microbiome, and as it gives your gut time to repair. It does a lot of work all day long, digesting and eliminating toxins. So this gives it a time to rest and repair, because sleep is actually a natural time for your body to remove toxins as well. So talk about organic foods. I know they're more expensive, so I like to give this website, ewg.org. It's the Environmental Working Group, who every year, this is last year's now, every year puts out this list of the Dirty Dozen and the Clean 15, which is really nice because if you don't want to buy all organic, you can buy conventional off the Clean 15 list. They have less toxic burden. But things like berries, which I love, you really have to buy organic because they're always on the Dirty Dozen list. The way they're grown, the ground is really soaked with pesticides. And last but not at all least, I want to talk about stress and autoimmune disease risk. And I always have this last, but think I should probably really just have it first, because the evidence is clear, and you probably know from your own experience that stress is a trigger. But it's also a cause of autoimmune disease. There's been huge studies done on this, and even included some myasthenia gravis patients that in this 1 million participant study that showed the link between stress-related disorders and increased autoimmune disease risk. And even going back to childhood trauma, conditions like PTSD or lingering trauma that hasn't been dealt with even as a child is linked to higher likelihood of developing autoimmune disease as adults. So I bring this up because I think we really need to deal with our traumas, not be afraid to feel our emotions, and include mindfulness into our lives if we want to really live our best life. Because myasthenia itself is a stressor, right? It can often lead to a lot of grief and uncertainty. We don't know what the outcome is going to be or when the next exacerbation is going to be, and this can lead to actually intensification of symptoms. So kind of a vicious cycle. So I think it's always great to have psychological support and help, whether that's family or professional help with a psychologist, counselor. Any kind of illness is a stressor. And if you're into the science of this, which I find fascinating, I just want to share what autoimmune disease and how it's related to immune exhaustion. There's a stress hormone called cortisol. It's our main stress hormone. And I used to think of it as the bad guy, but it's actually the good guy. It's just that with chronic stress, your body becomes less responsive to cortisol. So you have to keep having more and more cortisol being expressed. And eventually the immune system loses effectiveness after that prolonged chronic activation due to prolonged high cortisol. And something results called immune exhaustion. And from immune exhaustion, immune dysregulation and autoimmune disease can result. So a lot of times it can be that autoimmune disease is brought on after a prolonged ordeal with emotional stress. So how do we deal with this? One way is present moment mindfulness. Yeah, living in the present moment rather than thinking about past or worrying about the future, and accepting our emotions and feeling them as they arise instead of suppressing them or avoiding them. I love this quote. It's not always about feeling better. Sometimes it's about getting better at feeling. In our culture, we really like to suppress our feelings, but it's not always the best for us. Mindfulness eases autoimmune conditions like MG through lowering cortisol levels, which can reduce flare-ups and can lead to improved mood and can decrease fatigue and pain. There's lots of evidence for mindfulness meditations and other practices to help autoimmune disease. It can be through mindful breathing, focusing on inhaling and exhaling. It can help just foster calm and clarity. There's different kinds of meditations that you can learn about. Even walking in nature can be really beneficial. Art therapy, forest bathing, which I'll talk a little bit more about, in nature immersion, improves immune function, fatigue, and mood. And all kinds of mindfulness movement practices like yoga, tai chi, dance, and singing all help to reduce cortisol and improve stress, inflammatory markers, mood, and fatigue. I love to talk about forest bathing, which is slowly walking or sitting in the woods and bathing in the chemicals released by trees. This is really big in Japan. These phytoncides, it's the aroma that you can smell in a forest from the pine trees, has been shown to improve immune function, improve anxiety, fatigue, and depression, lower cortisol levels, lower heart rate, and blood pressure. Other ways of holistic health and MG to lower your stress levels are journaling for self-awareness. A lot of times journaling about your symptoms, maybe sharing them with your doctor or therapist, can lead to more insight in how to manage the disease better. Gratitude, daily gratitude practice, such as maybe first thing in the morning or right before you go to bed. Naming 5 things you're grateful for can be really small things. I'm grateful I have clean water. I'm grateful I have a warm blanket. Just this positivity makes a huge difference. There's been research studies on this in other autoimmune diseases like rheumatoid arthritis. And of course, prayer and other spiritual practices are also shown to be helpful. There's some studies also with acupuncture, mostly because it reduces stress hormones and can influence the immune system. There's been some studies that report acupuncture may help reduce fatigue and muscle weakness and improve quality of life in myasthenia. So I'll wrap it up in the last few minutes. In summary, from what I've talked about so far, is we want to choose anti-inflammatory choices. So that means adopting a whole foods, predominantly plant-based diet, exercise to your ability, stress management integrated into your daily life, and avoid inflammatory habits such as processed food, being sedentary, which is very pro-inflammatory. Also, high stress can increase inflammation and raise disease risk. Same thing here. Thinking about gut health, probiotic foods, fiber, sleep. And if this seems overwhelming to you, and you don't know where to start, I like to just talk about setting achievable goals, because changing lifestyle habits can be really challenging. And I am aware of that. But I say, I just pick one thing that can be impactful to you, something that's realistic, something that you know you can complete, that you're going to feel good about, not something that you feel like it's going to be too difficult and you're going to end up not being able to do it and then being disappointed. Something that maybe you can integrate easily into your daily routine. And always acknowledging the small victories, because change of habit is one of the hardest things. So an example of one thing you could do, I have a lot of nutritional information on my website, probably more than you really want to read about. But one example is, well, I don't know where to start with my diet, but I can make a smoothie a few days a week and I can have that and look, have the whole rainbow in it, plus herbs and things that are going to help my immune system and my overall health. I can do that. That's probably doable. Maybe one thing might be a simple breath work meditation that you take 10 minutes a day and sit comfortably and consciously breathe. I have an example of that on my website, and there's a lot of meditation apps that you can get now to help you with that. Just as an example, to pick one thing, because one success will lead to the next. I'm big for building support networks. Anybody who can help you, that, because a lot of times there's not other people in your household that want to change the diet or want to have a more active life. So it's really important to find friends or groups or church members or healthcare professionals that can support you. Behavioral therapists, physical therapists, nutritionists, health coaches are great if they're available to you. They can help you with all of these lifestyle changes. It's really, really hard to do it alone, and I wouldn't suggest it. Sharing your goals with others really helps motivation and accountability, making it easier to stick with new habits, because nobody can do it alone. And if you're interested in more resources on lifestyle, you can look at my website. I have like a lot of nutritional plans on there and some blogs with some other helpful tips. Yeah, and thank you so much. If you have any questions or you think I left something out, you want clarification on, please let me know.
Julie, that was so informative. Thank you so much. We do have a couple of questions in the chat. Do you want us to read them to you, or?
In the chat. Yes,
So,
because I don't see anything.
okay. The first question is, are frozen organic berries as good as fresh?
As far as I know, yes. I think, they'll freeze them fresh and might even be better than sitting on the shelf for a long time. So frozen vegetables too. And they're great for making smoothies. So yes.
Wonderful. The next question is, can stress-related autoimmune disease be brought on by the stress separated in years from the onset of the symptoms?
I mean, we're talking about a specific situation, but in general, yes, like when I talked about childhood trauma. So, childhood trauma can actually lead to disease many decades later. And the thought behind that is because it turns into chronic trauma. So it depends if you felt like it's been resolved or you felt like the anxiety from it or post-traumatic stress disorder continued since then. Yeah, that thank you for bringing that up because that was the point that I wanted to make. Can be years or decades later if it's something that hasn't been completely resolved. And
Wonderful.
it's crucial to do that.
Yes, thank you. The next question is, how do you deal with a morbidity? I also have severe heart failure.
Mm. Yeah, that's tough. Um, I don't know your specific situation. Um, and a lot of the things I talked about definitely apply. I don't know how much you could exercise with that, but obviously diet is crucial. Stress reduction and mindfulness is also similar. I mean, similar things that can support you or community, um, nutrition, all the same things. It's just, I would say, with the heart disease, it's going to be the exercise. I don't know where you are with that. So
Thank
get
you.
support with the mobility, physical therapist.
Thank you.
Yeah.
The next question is, how about supplements like, I'm going to butcher these, um, Thean for sleep, or Redola, or
Rhodiola, probably.
yeah,
Rhodiola, L-theanine.
for anxiety, sleep, and brain support.
Yeah. So, as everybody probably knows, myasthenia, so it's so unique, and every situation is so unique. Um, and you never know, just like with the medication, like with a supplement, if it's going to make you feel worse. So it depends on your individual situation. L-theanine, I have used ashwagandha, which is not rhodiola, in myasthenia with good success. It's not something I talk about on big webinars just because, like I say, everybody's so different. L-theanine is probably safe in general, but you just have to see. I, I'm for them. It's just everything's on an individual basis. Rhodiola too could be. I mean, rhodiola might have properties that could, what do I want to say, boost immune system, uh, which maybe you don't want. You want more of a balancer of an immune system. That's why I tend towards ashwagandha, but yeah, everything's very individual, so it's hard to say
Okay.
with a faceless person, you know? Yeah.
Thank you. Do we have any other questions from our audience that you would like to ask? Oh, what's your opinion regarding workouts in the pool?
Oh, I think it's great. I mean, you do. I'm for any kind of exercise. If you love it, I would do it. I mean, weight bearing is important, so I probably wouldn't only do exercise in the pool because it's more weightless. But heck, if you enjoy it, go out there, get in the pool.
Any other questions that you guys have?
I'm also open to if anybody has a share,
Yeah, or anyone want to
any
share
success
anything?
stories.
Does it matter regarding probiotics? I love sauerkraut, but don't eat the other probiotics. Am I limiting myself?
I think I would try a variety because each one has different. beneficial bacteria. So the profile will be different. And that's why a variety is really good to try. Yeah.
He says, thank you. We also got a comment that said, excellent presentation. I see that you're in Sedona. Does altitude make a difference?
I think you can adjust to it, but at first it will make a difference, definitely, especially with breathing, if there's any kind of compromise with the breathing and strength. But in general, your body will adapt to altitude. You'll make more red blood cells and you'll be fine, probably.
Wonderful. Another question, can you improve your strength with exercise with MG?
Can you improve your strength? Yes. That's my final yes.
Mhm. Do we have any other questions or anything anyone wants to share?
Yeah, never limit yourself. Like, I've seen people do amazing things. Just don't limit yourself about being too scared to do something or think you can't do it or think you can't succeed. I realize it's really difficult to see yourself trying to exercise when you can't do what you used to be able to do. It's just not fun to be able to feel limited. But if I have to tell you like the big success stories that I've seen, it's been with it's been stress reduction, but it's been with exercise. Like there's something about the fact that with myasthenia gravis, it's so easy to get deconditioned, and then you have all the secondary problems of being deconditioned on top of the myasthenia, which can kind of feel like myasthenia, when in fact it's that you haven't been as mobile because it's scary. You think you're going to feel worse. It's depressing because you can't do what you used to do, but just it's where you're going to get the most gains. If you just really be cautious, take your time, progress slowly, you really can make the most gains with it.
Deborah,
Go on the Facebook page. It's amazing.
yeah, Deborah shares that she has had success with mindfulness practice and adaptive yoga. For those of you attending, we featured Deborah a year ago. You can find the video on our YouTube channel of Deborah sharing her yoga. So check that out. The next question is, can you give a list of immune boosters that we should avoid that are over the counter? Like the Redola example.
I don't know if I could give a list because I think there's a lot of them. Like echinacea is a big one, and elderberry. Those are ones that, okay, so if they're kind of promoted for viral prevention, a lot of times they can be more of a booster. I hate to use that word because it's all real complicated.
Sure.
I love herbs. Um, they can, even ones that I'm saying to avoid might even help you. You know, I don't know, but I wouldn't probably take those two. I don't know about a whole list, but
Okay.
those two.
And then just a comment that Van Gogh said, if you hear a voice within you say you cannot paint, then by all means paint, and that voice will be silenced.
Beautiful.
Yeah.
Thank you for that share, and thank you for the Deborah share. I think it's just super important that we all just support each other and uh, hear the positive stories, you know?
Absolutely.
Yeah,
For sure.
because there
Well,
are a lot
there are. Have to find gratitude in every day. I
every day.
say
Yep.
that often. Well, and we are grateful that you spent the last hour with us, Julie. Our team is um, grateful that we were able to. This is a kind of a new topic that we have had on our webinar. So thank you for being here. And thank you all for tuning in and listening this evening. We'll have this up on our YouTube channel hopefully by the end of the week if you want to rewatch it. So that concludes our presentation this evening. Thank you again, and we hope to see you next time. Thanks, everybody. Bye.
Bye. Thank you.